Good afternoon, everyone. Thank you for joining us this afternoon. I'm Payal Patani, staff for Forbin Community Prevention Coalition. We are a program of Forbin Regional Council on Substance Abuse. Thank you for joining us on our third town hall meeting, and I will let Lauren Beckwick introduce our speakers.
All right, so next we have Dr. Celeste Conlon. Dr. Celeste Conlon is a licensed psychologist for private practice in Sugar Land. Her physical office is near Dairy Ashford and 90, but during the pandemic, she sees clients 100% online. She is also an LSSP and worked in schools for 20 years with a part-time private practice. Although about 9 years ago, she moved to private practice full-time. She is also a certified cognitive behavior therapist, holds a diplomat status from the Academy of Cognitive and Behavior Therapies. She's a board member of the National Social Anxiety Center. She's married to Dr. Bob Conlon, and they have 2 children together. Her 2 main specialties are children and adolescents, including anxiety, depression, behavior, ADHD, autism, and social problems. And then 2, she does all ages, and she specializes in anxiety in all its forms and also depression. Specifically social anxiety, OCD, and related disorders, panic, school and work refusal, social problems, and social skills. Welcome, Dr. Conlon.
Thank you. It's so nice to be here, and I really appreciate Dr. Shell and all her wonderful suggestions. I'm going to talk to you today about how we get ourselves stressed out and a little bit about what to do about it. I think it helps to know just how it works. And so I'm going to talk to you in a real practical way, pulling from some of the evidence-based strategies from cognitive behavior therapy. We have a lot of things to worry about these days, don't we? We have hurricanes and politics and protests and riots and COVID, unemployment, and how are we going to get our kids back into school safely? And that's not even our health or our families or our futures that we just normally do. And I just want for a moment to just talk to you about how are we all managing? Because you may not realize that everyone is in this together because we're so isolated. You're not necessarily seeing each other. You may be talking with a friend or 2, but I see people all day long. And let me tell you, no matter how you're feeling, you're not alone. There are a lot of people that are feeling the way you are. And partly it's COVID, partly it's just what's going on. I'm going to talk a little bit about just the mechanism for how we develop anxiety in the first place. And so the first thing to know is that our brains are so wonderfully made. We have 2 major parts to the brain. We have this fancy human brain that has all this good thinking that we can do up here and problem solving and math. And, if you're going to school, if you're working, you use this part of your brain all the time. But we have this other part of the brain, it's the old part of the brain, the automatic part of the brain, that every living creature on the planet has. And that's the part that makes our bodies work on automatic. I mean, think how exhausting it would be if you had to go around all day saying, breathe in, breathe out, breathe in. It just goes on automatic, and there it is. So we have breathing, and we have heart rate. And if you get too hot, you sweat. If you get too cold, you get goosebumps or the chills. It regulates our temperature. There's also this little tiny bit in the brain, in the old brain, called the amygdala. And that is where we get fight or flight. You might know about fight or flight. You've probably heard about that. And in a long time ago, when we did not have homes or air conditioning and people were just living off the land, we had to have fight or flight to save our lives. If you happen to come across a tiger, if you and I are walking out in the woods and we come across a tiger, think about what you would do. This is a live tiger. It's not caged up or anything. I don't know about you, but I'm almost sure that my feet would be moving before I had a chance to even think, because the amygdala gives us an immediate burst of energy and power, and we are moved to action. Some people freeze. Some people would stay and fight the tiger and yell. I'm not one of them. But this is the thing that's so marvelous about our brains. During the time when we are faced with an immediate threat, have you ever noticed when you're really, really scared that you can't think clearly? You might have been, let's just say you're driving in Houston before COVID and you're in crazy traffic and you drive and you have to take evasive action because somebody has cut you off. If you've been driving for a long time, you did that almost without thinking. And then after the immediate urgent thing was over, you had a flood of emotions. Maybe you were crying, maybe you were swearing, maybe you were just sweating or shaking. But if you're in a near accident, you're going to have some emotions, but you're also going to have this immediate reaction. That's the amygdala. The amygdala is what saves our lives. It allows us to take that prompt action. And even though we don't have tigers, most of us don't have to deal with tigers on a daily basis, that ability to have that fast reaction to save our lives, it's part of our biology. And it's a really good thing that we have it. Think about how that affects us with COVID. When we are hearing that we should wear masks and be socially distant, maybe when it was going on in New York, we go, maybe, maybe not. Different people had different ways of handling that. But when it became much more prevalent in Texas, and especially in our area, people got a little bit more concerned. That fear that we have has been able to protect us. That's the job of fear, is to protect our lives so that we can survive. And just so you know, the amygdala is the fastest reaction in the human body. We are built to survive, and it is going to take over. All right, so what does that have to do with anxiety? Well, I'm going to get to that, but I want to tell you about a couple of things related to pain and anxiety. First thing, when we're thinking about change, I think of 5 areas. First, I think about what's our environment. Then we think about what's going on in the body. We think about what's going on in the mind, as in our thoughts. What's our mood like? What's our behavior like? So we've got those 5 areas, and we can't always change all of them, but they're all interconnected. So if you change one, you might change, you're going to have a chain reaction in the others. If we have COVID, we can't necessarily go live somewhere else. We just have to put up with it. So we can't change our environment, but we can change what we decide to do. We can change our behavior, or we can change our attitude. If you have pain, you cannot, it's like, well, my body is involved. How am I going to change that? There's still a way to address pain in the body by using one of those other areas, changing your environment. Going outside and getting some fresh air often will take your mind off of it. Of course, people have different layers of pain, and so I'm not wanting to discount anyone's pain, but there are all of these things that cognitive behavior therapists do with pain, including changing your attitude toward it, addressing some of your feelings, changing your behavior, and some of the things that you do with your body. In fact, when we look at anxiety and pain, if you go into a pain doctor, they'll give you a chart of your whole body and you're supposed to X, where does it hurt? If you come into an anxiety specialist, They're also going to give you a picture of your whole body and ask you, where do you feel the anxiety in your body? And it's many of the same places where the pain would reside and where the anxiety would reside. And in fact, it turns out that there's a strong connection between pain and anxiety. You also might know that anxiety is the most common mental health concern that we have. 25% of the population suffers from an anxiety disorder sometime in their lifetime. And somewhere between 35 and 60% of chronic pain patients also are diagnosed with anxiety. Most commonly, panic disorder or generalized anxiety disorder. What we don't know is which came first. We do know that people who have an anxiety disorder but maybe never did anything about it, if they happen to get chronic pain, then their anxiety gets worse and then it gets reported. People with pain and people with panic have some similar vulnerabilities, like they're more easily aroused. They notice things in their body. Like, think for just a minute. Think about your feet right now. Think about the pressure that is on your feet. Maybe your feet are on the floor. Maybe you're wearing shoes, or maybe you're not wearing shoes. But wherever your feet are, they typically are pressing against something, and something is pressing against them. Now, that's a somatic cue. That's your body cue. But most of the time, we ignore that unless you're doing a mindfulness exercise. You wouldn't even think about unless your feet are hurting. You're not going to think about the pressure on your feet. Most of us go around and ignore gravity. But where we put our attention and where we notice things differs. If a person has pain or if they have panic, they typically are more sensitive to those things. It's also possible that some people use worry as a strategy for reducing their sensitivity to their body experiences, making them more prone to developing anxiety. Let me give you an example. If you're in pain and you sit with it and you're thinking about the pain, you might eventually decide to do something about it. You might get up and move around. You might look on the internet, try to figure out what's going on. You might use Dr. Google, and try to diagnose yourself. You might do a lot of things, but while you're doing all of that, worrying and wondering and thinking about it, your mind has gone away from the pain and it's on this intellectual activity. And so worry actually becomes kind of rewarding because it is a habit that you can use to avoid the pain. And so that's how worry can get established in a person that has pain. Just know that there's a lot of overlap between pain and chronic pain and severe anxiety. And the worse the pain, the worse the anxiety in most studies. There is also connection in the brain. I was just talking about reward, how worry can get kind of rewarded because pain goes away. The same thing happens with addiction. There is a reward system going on in there. And I'm not an expert in pain nor addictions, but in general, we know that these mechanisms overlap. And I'm telling you about this because I'm going to get around to telling you about fear and avoidance. Even substance abuse itself becomes problematic because it's used as a form of avoidance. It's very quick and it helps a person avoid whatever it is they need to avoid. So the thing to know is that nothing feeds fear like avoidance, whether it relates to addiction, career, love, health, anything else that matters to you. It's fear that keeps us stuck, and we can change our situation by learning how to manage the anxiety. One of the things that happens quite a bit with any sort of mental health issue is that we get stuck in the way we're thinking about things. So there is this automatic process. Remember, I told you we have these automatic fear reactions. Well, we get in the habit of having automatic thoughts that go along with them. If we are having a problem, then we automatically look for the negative, and that's part of the brain. You know, that's just part of our history of our biology, is that we look for the negative because we want to see, is there a threat out there? And so we automatically go to sometimes the worst case scenario. Think about COVID. A negative thought might be, COVID has ruined everything. Life will never be the same. What we know from cognitive behavior therapy is that thoughts are not facts. COVID has not ruined everything. Life will never be the same. That might be true, but we actually don't know. We don't know if COVID has ruined everything or something else has ruined something. We just don't know. That's basically not a helpful way to think. We could think instead, COVID will pass, humans will survive, and we will find new ways to be social again. We've been talking a lot about that, but what about pain? What about if you're in pain and you have a thought, my pain will never go away? Unless you have the superpower of being able to, predict the future with great accuracy, how do you know that your pain will never go away? Maybe, but a more helpful thought might be, my pain fluctuates. Some days it's better than others. That might be another way of thinking about it that at least is slightly more helpful. How about this one? I can't resist taking pain medication. I need it. Nothing else works. That's a negative thought. It's pretty helpless and hopeless. It might be more helpful to think that with help, I can learn new ways to respond to pain sensations. I want to find a safer way to handle my pain. Maybe I can look at some of these more natural ways. Maybe there are different things that I can do to turn down the volume a little bit, to make it a little bit more tolerable. Here's another thing that happens with anxiety, a negative thought. She's looking at me like I'm stupid, like I'm a loser, like I'm weak or flawed. I don't want to be around that person. Those are thoughts, but they're negative thoughts, and they're not particularly helpful. What's more helpful is to think that other people have thoughts. They might be bad or they might be good. I actually cannot read other people's mind, so I don't actually know what someone else is thinking. I just think I know what other people are thinking. But other people's thoughts are also not facts. They're just thoughts or ideas or opinions. And just because someone has a thought doesn't mean we have to act on them. So I want to tell you about how avoidance becomes a habit. And I'm going to see if I can share my screen. We'll see how this works, because earlier today when I tried it, it froze up. So let's try. All right, here we go. So how does avoidance become a habit? I'm still not happy with this. Let's see if that works. Can everybody see that? I hope so. So
no, we can't see it.
You cannot see that.
Paul, you want to turn off the spotlight?
Try one more time. Ah, here we go. How's that? Can you see that now?
Yes, we can see it now.
Great. So how does avoidance become a habit? All right. this is just a little simple graph. I want you to think about not necessarily the lines of the words on here, but just what's happening here. When we are exposed to a scary situation, we are going to have a reaction in our body. In this case, it's adrenaline going up. Now, you may find that when you watch television, if you watch the news or you're on social media, if you pay close attention to your body, we don't have all this fancy equipment in our homes, but if you were hooked up to all kinds of electrodes, we would see some change in your body when you see something scary going on. If you're on the media, you could do it if you saw a tiger in the woods too. But our bodies are going to react when they are faced with something scary, and we're going to go up with the adrenaline, and eventually it's going to come down. And so that's the first thing. The second thing is, and this is not the prettiest slide. Let's go back. This right here is a curve that goes up and then back down. This is the first time a person gets stressed out. The first time someone gets stressed out, up goes the adrenaline. And in the average person, it takes 10 to 30 minutes for that adrenaline to dissipate until it's back to the normal level. But most of us don't have just one thing going on. Just as we go up and things begin to level off, let's say back before COVID, you were trying to get your kids in the car to take them to school. Everybody is rushing around and arguing and maybe losing things, and there's all this chaos, and finally you get into the car, and as you finally got everybody into the car, and now the car won't start, so you get a new surge of distress coming up. And while you're trying to get the car to stop, the kids start fighting in the back seat, and then it starts raining. And then something else happens. I mean, this is much more like what people's daily lives are. We don't have just one stressor. We typically get a chain reaction of them. And so if about here is where average levels of adrenaline live, as we absorb these multiple levels of adrenaline and these events that keep stressing us out, we get used to living closer to up here. This feels like normal. And if a person has an anxiety problem, they mostly live up here. And the problem with that is over time, this level of chronic stress leads to physical problems. It wears us down physically, and that's where we get chronic heart disease and other just wear and tear on our body. So if a person has anxiety and they're stressed out with blood pressure, it's a good idea to do something about it. But right here is what happens with the other thing that happens. And this happens whether it's with an addiction or with any other kind of a thing that we're doing, panic or whatever. When a person gets anxiety and they start ramping up with the anxiety, and it goes up and up and up, about right here, people say, enough, I can't stand this. I can't do this. I don't want to do this. It's too hard. It's too scary. It's too awful. And they will do almost anything to avoid it or escape from it. And as soon as they do, the anxiety drops. And it's wonderful. Let me do that again. That is so rewarding. I feel so much better. The problem is, this is habituate, but there's no new learning. Nothing new the person has not learned anything new. And so when they are faced with an anxiety-provoking situation again, the anxiety comes back and we go around again. And we do it over and over and over like that, around and around and around. Then we're just stuck. That's an automatic process. Now I'm going to try to get you back and see if I can get off of screen share. Am I still on screen share? Or do you see me again?
You're not still on screen share, but we are close to 250. So we do need to move on to more.
Hurried up. Okay, I can do that. So That's how we get into the habit of using avoidance when we have fear. That's just the main thing you want to know. And when we get into the habit of avoidance versus fear, we don't judge well. We're just busy onto avoidance. Look, our risk perception becomes really distorted during those times. So I wanted you to know how we get fear started, because if you have a lifestyle where you're avoiding change, whatever that is, if you are overloaded with stress and you're just living with it and just bearing it's not healthy. And so I want you to know there's help. There's ways to get past this. There's some self-help strategies you can use. You can work with a therapist, but there is help. And somewhere in here, I bet my contact information is available. Please feel free to reach out, and I'll point you in the right direction. I don't want to take up more time, so I'll just end.